Welcome to this podcast created by Newcastle University Business School, or NUBS for short. The Oxford Dictionary states that the nub of something is the central or essential point of a situation or problem. So we hope that in this series we can help you to get to the nubs of it. This podcast series looks at a key theme of value, the value of our creative economy, the value of our student experience, the value of our research, the value of our collaborative networks. In this series, you will meet academics, alumni, students, graduates, and professional staff of Newcastle University Business School as they talk about what value means to them. In this episode, join your host, Ashleigh King, as she speaks with Dr. Rebecca Casey, Dr. Fiona Whitehurst, and Dr. Karen Elliott about the role of the digital economy. Dr. Rebecca Casey is a senior lecturer in Information and Systems Management, and Dr. Fiona Whitehurst is a senior lecturer in Management. Dr. Karen Elliott is a senior lecturer in Enterprise and Innovation. Rebecca, thank you so much for coming in today.
Hi Ash, thank you for having me.
So I'm really excited to talk to you today and to tell our listeners as well a little bit more about you and your research and some of the amazing stuff you've been doing over the last year, and also some of the fantastic projects you get to do at Newcastle University Business School. So without me rambling, I would love to let you introduce yourself and tell our listeners a little bit more about you.
Okay, thank you, Ash. So, my name's Rebecca Casey. I'm a lecturer and researcher in Information Systems Management. A more contemporary label for that would be digital business. But mostly my experience and research background has been in digital health and digital healthcare. And so at the business school, we try to take an approach whereby our research directly informs our teaching and vice versa. So over the last year, I've been most interested in the COVID-19 app and how that's developed. I've been involved in several projects in the past with hospitals and NHS trusts, looking at how they invest in technologies and implement those technologies and evaluate those technologies. Thankfully, in this country, when you're investing public money, there is a mandated approach when you're doing that to evaluating whether indeed you will be delivering value for money. And so there's a particular approach that's used in the NHS called benefits realisation. And really, that's just a process model for ensuring that you organise and manage the acquisition and implementation of technology such that potential benefits are realised for you and I and other stakeholders as well. So it was back in September last year when the app launched, and I became interested in it because at that time they had already spent I think it was close to it was 11 million at that point of taxpayers' money. And I think one of the things that struck me was, countries all around the world are developing these apps and have already gone farther down the line in developing those apps. So why are we developing our own app? What is the benefit for our citizens in doing that? Why are we not making use of, say, for example, South Korea's app or Germany's app or Estonia's app? So, I really became interested in that. And also at that point, there had already been a few glitches with the app, with incorrect predictions. They had also changed tack in terms of how they were developing it. Initially, they wanted to have it developed in-house on a centralised server, and it was the epidemiologists were really keen to gather everybody's data. But of course, the privacy and citizens group said, gosh, absolutely no way. It would be a tantamount to mass surveillance, which is the approach that they had taken in South Korea. But culturally in South Korea, it's more acceptable. So they had switched tack, and at that point, they had already spent £4 million on developing the app to that point. But then they switched over to make use of the Apple and Google's technology, which would ensure that our privacy as citizens would be protected. So it's never straightforward when you embark on any kind of investment in technology in healthcare or in the public sector generally, because when you think of the notion of public value, there will always be a trade-off, and you always have to balance, on the one hand, the needs of citizens. So if you think about in the context of healthcare, that's, length of life, quality of life, things like that. And balancing that with government needs, which is about ensuring that they deliver value for money, and, they're the budget holders. So they have to think about that. And then they also have a responsibility to protect public health as well. So there will always be a trade-off, which is why taking, a formal approach to evaluating the benefits and the risks is really important. But of course, we know that throughout the pandemic, technology has been developed at pace, and perhaps with not all of the checks and balances that would normally happen outside of the pandemic. And in some ways, that's a good thing. And in Scandinavia, a group of researchers there over time have developed, because the approach we take, where we, evaluate benefits and risk, it's the similar methodology is used in Scandinavian countries, in Australia, New Zealand, many of the Commonwealth countries. So we're not the only ones that take that approach. But what they've done differently in Scandinavia is that they explicitly address 3 other areas. So when you're developing technology with other partners, and that's what happened with the app, a lot of private contractors were brought in. So when you've got public and private organisations working together to develop technology, there are other factors that need to be addressed. So, in Scandinavia, these 3 kind of factors are, firstly, alliance governance. So this is ensuring that there's trust between partners, that there's goodwill, and being able to establish and foster that goodwill and maintain it. And then there's also the kind of more hard controls like contractual agreements, and having good, robust contractual agreements. And that's one of the reasons why the government set up an organisation called NHSX, and they were the ones who were given responsibility for developing the app. And they were established in 2019. It was really because Matt Hancock had developed this technological vision for healthcare, and he set up NHSX to help, formulate that strategy, but also help execute it as well. But yes, so if you don't have effective alliance governance, there can be confusion, and that you can also end up with conflicting priorities, horrific contractual breaches, or people reneging on what they've committed to do. So that's one aspect that we should look at. A second is technology-related collective strength. And when NHSX, following the pressure from privacy groups and citizen groups, and they changed tack and decided to build on Google and Apple's technology, that arguably did kind of begin to satisfy that dimension of creating a collective IT strength. But really what you also need is adaptability. So you have to have the opportunity to be able to adapt technology, and that's really what we've seen a struggle with the app. And also there's this aspect, when you're creating a technology-related collective strength, of knowledge transfer and learning. Well, the knowledge transfer, the IP, who does that sit with? Does it sit with the private contractors who've developed the app? Certainly the source code sits on GitHub, so that's freely available. But in terms of the changes and the ongoing development, And also a lot of the statistics around that is certainly not fully transparent. And then thirdly, the other kind of condition that should be looked at is power and politics-enabled conditions, which is a really important dimension of any kind of public sector investment in technology, because you will always have, just because of how many people are involved, and you think of private contractors versus public bodies, they have different interests, different goals. Private contractors are clearly there to make money. They're profit-making organisations. They are not driven necessarily by, delivering value to the public. So we've got to take into consideration self-interest and, differences in status as well amongst individuals. Because don't forget, with the development of this app, Matt Hancock himself, was quite high profile and wanted a very kind of personal involvement. What we know about digital contact tracing is that it's most effective when it's implemented at the very beginning of an outbreak. So it was used very, very effectively with Ebola, for example, and tuberculosis. So digital contact tracing is not new. It has been used before, but we know that it's far more effective when it's used right at the beginning of an outbreak. And it's absolutely crucial if you are going to successfully realise benefits and value from a technology such as digital contact tracing. People must trust it. Oxford researchers said from the outset, if this is to be effective, we'll need, at least 36 million people downloading and using this app. Well, to date, it's 26 million. One of the figures that isn't being measured weekly is how many people are deleting the app. So the Department of Health is certainly doing ad hoc surveys, but they're not measuring in the same way how many people, so they measure every week how many people download it, but they don't measure how many people are deleting it now. But you just have to go and look at the statistics to see that there's a fall in terms of QR codes being registered and now the number of people being pinged because people are clearly deleting it. So yeah, it's really, really important from the outset to establish that trust with citizens. So, I made a number of recommendations about how NHS and how government organisations could be more inclusive and democratic in involving people to understand these fears and overcome them, to more successfully realise value from technologies such as the contact tracing app.
I think it's really fascinating what you've said there, because you've talked about a very broad overview of the research, which is great because it actually is so helpful for all of us listening. We've all experienced COVID and the pandemic in our own way, and we've got our own individualized feelings around that. But actually, this app had the power to change lives and to save lives. And one of the questions I have for you, and I'm curious about your thoughts on this, is were we just too naive in the West? In the UK, did we just think we were invincible? What I mean by that is, looking at other countries who really got in early and got in fast. You mentioned that a lot of this contact tracing technology has been around for some time, actually used for Ebola and other viruses to track them. But we haven't had something like this ready. So I'm curious about that readiness for digital change and readiness for these types of activities in the first place. Do you have any thoughts about that?
Yes, I do. And I think it's largely for political reasons, unfortunately. It's a shame, really, that countries didn't collaborate more quickly and more effectively at the beginning of the outbreak. So as I mentioned, dozens of countries began work developing their own apps, where really what would have been preferable would be for countries to have worked together in developing apps and making that development open source as well. If that had happened, and as I've mentioned earlier, we know from previous outbreaks that digital contact tracing works most effectively right at the beginning of the outbreak, when people are more engaged and more ready to be able to respond to what the app is trying to do, which of course is alert people and, break, and interrupt that chain of infection. And people are more ready to do all of the other things that, because it's not just about the technology, it's about making sure that there is still social distancing, that we do isolate when we need to, or quarantine when we need to. And at the beginning, people are more likely to be able to follow those behaviours. So I think if countries had worked more collaboratively from the outset on the technology and shared that technology, we probably all would be in a very different place right now.
And I know it's not our place to necessarily criticise our governments and our world organisations, but whose responsibility would that have been? So this is the question around, if countries had worked together, would that have been the United Nations, the World Health Organization? I mean, if they had mobilised together, as you've said, could that have been different?
I think so, and it's a really great question, and I'm not sure there is a straightforward response to that. But when we think back to the initial outbreak, the organisation that did lead on guidance for all of us globally was the World Health Organization. So, perhaps there, was a role for the World Health Organization to think about the role of digital contact tracing. And again, it goes back to, having that technical capability as well. And that isn't always there in a single organisation, which is another reason why when you're thinking about, technologies that are, operated on such a large level like the apps are, you need to work collectively and draw on collective technology strength, because it might be that you don't have that. But certainly, I don't see any reason why the World Health Organization could not have reached out earlier and, and worked with, the tech giants, for all of their flaws, did come out early on and say that they were working on APIs that could be used, and they were ignored initially. So sometimes we have to kind of overcome historical events and think, well, in the interests of global public safety, we have to find a way of working collectively and collaboratively. And I think that's why this model I mentioned that works quite well in Scandinavia, taking into consideration these dimensions of the alliance governance, the collective technology strength, and then understanding the power in politics. It's so crucial, and perhaps if we'd done that, led by the World Health Organization, we might be in a different place.
It's interesting, and it's always you can always see such a different view in hindsight. So we can't necessarily say how different it would have been. But I'm very curious, listening about your interests in digital business, healthcare, and inequalities in healthcare. I'm curious about whether maybe there has been something around, it's great to have an app, and it's great to have an app for people to be traced and tracked. But what about those people who can't use an app or don't have a phone? Or are there inequalities that you see and that you've responded to in your paper or considered around those people who may be marginalized in some way?
Yeah, most definitely. It's a really great question. So I've been involved in other projects in digital health, one being telehealth. So it's quite similar, because what you're doing is you're asking patients to use smartphones and other medical devices. And it's about keeping patients at home, rather than them having to come into hospital. So patients with long-term conditions, for example. And what you do is, give them some medical devices so that they can take their own readings, such as temperature or blood oxygen saturation levels, these types of vital signs, and that, they do this every day, and then they text in via an app or using SMS. They text in these readings, which are picked up centrally in a hospital by clinicians. But also you can use software to monitor the readings, and if there's anything outside of normal parameters, it triggers an alert and a clinician would intervene. Now, like the digital contact tracing app, there's just this massive assumption that everybody has a smartphone or has a mobile phone and that they can use them. But of course, many people have eyesight problems, dexterity problems. There are lots and lots of reasons why people cannot use these technologies and don't wish to use these technologies. So, it's really important that we don't assume that everybody will use these technologies and that they're not a magic bullet solution. And in fact, what we are seeing now, McKinsey did a survey recently on consumer sentiment, and what people are saying quite clearly, especially in healthcare, is, okay, we've had to use some, digital services over the pandemic, but we are desperate now to return to face-to-face and physical contact with our clinicians, our nurses, our doctors, because people understand that actually they need to have that holistic view of their health and their well-being, and that can't be managed through an app. So yeah.
Absolutely. I think it's really important that whatever we do, especially when it comes to people's health and welfare and well-being, it's wonderful that we're making incredible technological advancements across the globe, at such a pace and such a fast change. But we don't leave people behind. And I think that's really, really powerful. And from all of your research that you've told us about today, I can see how that could happen, and how that has happened actually in some of our ways that we have dealt with the pandemic. Thank you so much for your time, Rebecca. I just wanted to ask a last question. If you could describe Newcastle University Business School in one word, what would you say?
Engaged. I would say engaged. I feel that it's such an important part of what we do, that we don't sit in an ivory tower, but that we are engaged with our students, engaged with business, with our local authority, with our local healthcare organisations. We don't operate in isolation from any of those key stakeholders, if you like. So yeah, engaged. In one word, I would describe our business school as engaged.
Perfect. Well, I hope that this has been engaging as well for our audience. Thank you so much for coming in.
Pleasure. Thank you for having me.
Yeah.
Thank you.
Hi, Karen. Thank you so much for coming into the studio today.
Okay, thanks. Nice to be out,
Yeah.
out and about with all the lockdown. So
Absolutely. Actually, despite lockdown, despite being on sabbatical leave from Newcastle University Business School right now, you're still working your socks off and networking galore. Can you tell us a little bit about yourself, who you are, and what you have been doing recently?
yeah, so I'm a senior lecturer, associate professor in the business school, and I'm, the only one really who specialises in FinTech, which is financial technology, and that's led me to work under the banner that's called the digital economy. But under that banner, there's lots of different things. And what I've focused on the most in working closely with computer scientists at the computing school with Professor Advan Morsel is leading two projects. One called FinTrust, which is looking at trust in the technologies that we're using, which links to one of your other ones about ethics and sustainability. So I won't go too much into that one. But the other one that I'll talk about today is called FinClusion. So that's like looking at how do we make it work for a digital equitable society so that it works for all and not for the few. Because if you think about finances in general, the system holds a lot of barriers for a lot of different people. So I've been working across that extensively, and I'm also working towards 3 different bids at the moment, which I can talk a bit more about.
So much to talk about, so much research you do. And I love that you've given us a really clear separation there between, although you're working in the digital economy space, you've got FinTech inclusion, the financial inclusion element, and the FinTrust. And I think that is so important because earlier in this series, we were also talking to one of your colleagues, Rebecca Casey, and we were looking at the inclusion for those who could not maybe use certain, who might not be able to use the NHS app, or digital inclusion in those ways. So it adds to the series really nicely. One of the things that I wanted to ask you first off is what led to your interest in the financial sector or financial inclusion, and has that been something you've always been interested in?
Well, my background is behavioural psychologist or sociologist that I studied at Durham University before I moved to Newcastle. And then prior to that, I was in industry for almost 20 years. So working in a variety of projects and companies as a project manager, then a program manager. So I worked on various different projects. Some of them were around getting 18 to 24-year-olds back into full-time education and training. And there you witnessed lots of barriers and systems. And it wasn't until I went into academia full-time, so I already had 2 degrees when I joined Durham, and I did 2 more while I was there, that I actually started thinking about systems. And then when Professor David Byrne, who was an eminent professor there, said to me, "You're a systems thinker, because you look at the complex adaptive systems, how they affect our lives, and how when they move, everything else has to adapt around." And if you think COVID's a perfect example of that, all the systems in our lives have completely changed because of one event that emerged in the system and has made all the rest adapt and change around that event. So if you think around that as inclusion as well, so Rebecca's work it's sort of touching on it, but she's staying on the one vertical of health. And what I've learned from the vertical of FinTech, I'm now looking to go across business, health, society, and government advisors as well. Because what I'm looking at in terms of inclusion, like I say, touches a bit on ethics and data, is what are we doing for societal good, and what are companies doing with data and digital that could potentially cause a societal harm. So I've also been working with lawyers to understand the legal frame, because I'm not a lawyer. And this goes across all sorts of different systems. So I've been working with the Astor Foundation, looking at, they've got over 100,000 clients who've come from all sorts of marginalised backgrounds. So in speaking to them, they're really excited to have somebody who wants to give them a voice and actually say, what is it like to be that? Because you and I don't know what it's like to be homeless, completely outside of the systems, not able to access them. And so the FinClusion project specifically, although this did focus on finance to a certain extent, was if somebody wants to be financially included, usually you have 3 kind of attest to this is who Ashleigh is. So you have a driving license, passport, and a utility bill. If you're homeless, how do you get those? Because you have to be living somewhere to get a passport for a certain amount of time. Same with utility bill. Same with a driving license. They will have your address on. So where we're moving with verifiable credentials is to say, what could we use instead? And we looked at the NHS as to say they could attest to who you are. And we built a prototype around that, which will be on your phone, so that you can actually verify who you are. But we need to go beyond that, because even some people in the periphery, such as travelling communities, don't have an NHS number. So what can we use for them? So we've done the first stage, but hoping to get, as always, more funding to do the next stage of the prototype. But this really spurred my interest to think, well, if it's happening just around finance, it's got to be happening in other different societal systems. And what are the barriers to have, what the funding bodies want, which is this equitable digital society. And like Rebecca touched on, how do we give people skills? And there's great foundations like the Good Things Foundation. They provide free online training for people so they can get them. But at the moment, we've got 7 million people in this country who still don't have internet access. And 9 million, even if they had access, they need help to actually use it, understand it, and benefit from it. And I remember sitting on a panel and saying that technology, including financial technology, is still pretty much a middle-class privilege. If you're educated, you have access to the internet, you can pay for it, you understand how it works and have those digital skills, you are going to get the rewards of benefit investing in different companies that can make you money, etc., etc. And if you think that broadly across all systems, the same sort of barriers, the critical barriers come up. And that's what I'm trying to address. We're just in the middle of putting in a bid for some network money to build a network about beyond a data-driven society. So how do we start to break these barriers down through partners across industry, academia and society, so we get this ultimate benefit? So.
Wow. Well, I'm just gobsmacked at the stats you've just said. So, for instance, that many people to be unable to access just internet in the first place, or a phone, or some kind of just an internet connection, and then also knowing how to use it. I think that's really important, because I think so many people take for granted that we think, the world is moving so fast. We've got so many social media sites. We spend so much time on our phones or online. But actually, there are people who genuinely don't have that experience at all. Yeah. And so then there is a risk of leaving people behind. And the other thing as well, which I think can happen, is we can assume that everyone is the same as ourselves. And so what I mean by that is, there can also be challenges around how people use something, how they interact with a piece of software, or and I know we've spoke about this before, so we don't need to go into it at great depth, but just the kind of, even with our UK government tax support, the work that they've done to restructure how, ordinary individuals can actually access their tax records, their self-assessment records, or business records, that has changed substantially because of user information and feedback. So it is great to see some improvements there. I wanted to ask you a little bit about FinTech specifically, from the interest point of how broad is the FinTech environment, the ecosystem. So for anyone listening, they might hear FinTech and go, okay, I think I know what that is. It's financial technology. But how far across does that touch our society?
Well, it does. I mean, this was an American report I read this morning, but they were saying for every dollar invested, 5 are invested in FinTech. So it's growing huge. I mean, the UK is number 1 in Europe, although we're not really technically part of Europe anymore, but they're number 1 in Europe for FinTech. But China and the US are outdoing us in terms of venture capital investment. So actually, it's just growing, and it's changing the monopoly. So if you think of the monopoly of the incumbent banks, the usual banks that we know, the monopoly is changing, being broken up. So have you heard of open banking? Yeah. Most people will have heard of open banking now. So we've got this global open finance centre of excellence at Edinburgh University that I know the 2 key players there and been involved in that. And what their APIs are doing there, so application program interface for people that don't know, is it allows you to see your bank account, your credit cards, details, and then third parties can offer you better rates on that. But that is still only about 13% of the current financial market. Again, if you don't have the skills, if you don't understand it, if you don't understand how it works, or there's a trust issue, because people know the incumbent banks. Yes, they don't trust them that much after the global financial crash, but they still know them. So it's almost like the better the devil you know, then there's all these other companies coming up offering me ways to pay, different things to do with my money. I mean, if you think about the switch campaign to switch your current account, not many people did, in essence. So you can see this similar thing around people not being fully aware of the benefits, perhaps afraid that they don't have the skills, and that maybe makes them look, inferior, or whatever they feel, or a bit of inferiority complex. I can't admit that I don't know how to work this, and therefore they don't use it. So until we get a bit more awareness up and support people through that, but again, we come back to the point, it's premised on being able to get online and having a smartphone. And yes, there's work in Africa that people will have heard about, M-Pesa using the SIM card, etc. And there's lots of work with the Turing Institute that we've been involved in, who are looking at how can we use that and adopt it and spread it here. But that's still emergent work, so we haven't quite sorted that. Same with the verifiable credentials, because the ultimate way of the verifiable credentials is that you would have control over your phones. It's called self-sovereign identity. So we did a prototype for it. So in essence, when we do get a credential that we can attest as you only show an attribute of that. So you'll only show, say, a number that shows you've transacted with a landlord, for instance. And that's all anybody needs to see. Now, people go, oh, well, what about privacy? What about know your customer, etc.? If you're a business, particularly a financial business, you have to do this by the regulators. But if we think about it, there are physical examples where that happens. So you have the blue badge scheme for disability people. When you see that badge in a car that somebody has some sort of disability, but you don't know whether it's physical, mental, whatever. That's not revealed. And that's the kind of same premise as this. Yes, there are issues around verifying that somebody's entitled to that badge, because humans will always defraud a system if it's there. And the same thing with the lanyard scheme. So if you've seen the lanyards with sunflowers on, and this is accepted in different institutions, if somebody walks on with a lanyard on with sunflowers, they know that they, again, have got some sort of impairment, but they don't know what it is, just that they need a bit of extra time or extra help to understand a process that they need to go through in an institution. So if we can replicate that in a digital setting and make sure we've got the privacy in place, and the regulators, so for instance, Financial Conduct Authority would say, yes, this is how we're going to do it, then it would be widespread adopted. But again, that's emergent research that we're looking at. But there's so much to do in the digital divide, because I think the digital divide is just basically the ability to transact, to engage. Do you necessarily need a bank account? Well, no, you've got Bitcoin and blockchain, and the whole decentralized finance or DeFi space is starting to branch out and research on how we could do things differently. So like you say, my interests are broad around what's out there, but ultimately my goal as a sociologist, no surprise, is how can we benefit society for the masses rather than just the few? Because otherwise the rich will continue to get richer from all the new technology because they know how to use it, and the poor will get poorer, and then there's sort of us in the middle, like working out how much we can spend to benefit, etc. So you just get this replication, and there's lots of people doing great stuff across the country, but there's a little bit of fragmentation because charities are fighting for the same funding pots, academics are fighting for the same funding pots, and maybe a little bit more coordination would be good. So one of the bids I'm putting forward is I know it's digital ethics, but it's going to be called Digital Ethics Hub. And this is going to continue our streams of research as is, but broaden it out across health, business, and use the ecosystems. So like you say, the ecosystems we have sort of FinTech North, FinTech Scotland, Innovate Finance in London. And then they've spread across to the West. We've got FinTech Ireland, FinTech Wales. So when these all join up together, you can see that's quite substantial. So that's a membership body. So on average, you've probably got 300 to 500 members all working in the fintech sector. Then you add InsurTech, which is around the insurance, breaking up the insurance industry. RegTech, looking at the regulations and how we can use technology to improve that. Then we've got quite a large, significant body. But then again, if you want to push change through this, there's a resource implication depending on the size of company. So if you're an entrepreneur like you, how can you work in the same way as a multinational? You can't. So when we're looking at introducing regulations or ethics, like the other colleagues touched on, then you could have like a multidisciplinary universal board that could act and advise on how to be ethical. The bigger companies pay a higher tariff, and then the single entrepreneur, the sole trader, gets it for free. And then as they move up the ladder and scale up, then they start to pay a little bit more, and then everybody gets a kind of shared economy. And this is like the decentralization, that nobody really owns it, but it's for the greater good. That always comes with the caveat that I know there's a dark side of human nature, and somebody will always try to buck the system. And we've seen that in COVID, in the rise in scams, 43% rise. And who do they target? The marginalized people who don't understand the systems, don't understand that telephone call that says it's from Lloyd's or the TSB, it's not really them. The phone has been scammed. I know.
It's true. It's so interesting what you're saying there about the cross collaboration and interdisciplinary approach, because I think all of this is so much wider than one industry. For instance, you were talking about insurance tech developments and pension tech, or your regulatory organizations, and this is where I'd love to hear just a couple of points or your thoughts about the role of data. So I know you're really interested in blockchain, which I am as well. And I love that, because whenever I hear you talk about these things, I find it so fascinating. And so, for instance, how can we use data cross-collaboratively, in these ways to actually help industries to move forward, make these decisions. A lot of what you've said there about the challenges that people are facing and we're facing as a society. Can we use blockchain? Can we use big data to solve wicked problems?
I've got more stats for you. So 92% of data leaders say it's not the technology that's a problem. That's about 8% of the problem. It's humans. So that's why I sit in that social technical space, because I understand the humans, and I've just finished a course in machine learning at the London School of Economics to just understand exactly how they build the statistical models. So now I've got further insights into that and the bias and all the issues around that side and the ethics, etc. Like you say, we can use the technology, but it's humans, processes and skills that are holding us back. I mean, you'll hear the government aren't sure because there's this huge skills gap and talent gap. And you'll hear companies in around this area, which will be repeated across the UK. We need more talent. We need more people coming out of universities or school that have these skills. They can code and program, but also think critically, but also they understand culture and can work in teams. Because if you think of our education system when we are children, we're going towards a single goal to pass that exam. Is that a team activity? No. That's teaching you to focus on a singularity and train yourself to pass an exam, which doesn't make you think. You just regurgitate knowledge, but you're not actually thinking in that stage. It's probably only when you get maybe into A-level higher education that we actually say, come on, Ashleigh, we now need you to think critically. But you haven't been taught how to think critically. You've been quite singular in achieving one goal, which is an exam, which is repetition. It's not really thinking, because the curriculum is specific in giving you the basic skills. And it's only as you go through and challenge yourself. So we've got this problem that we have a lack of skills on one side, a lack of an awareness of where you can go to, and then employers want a high standard to come into. And then also, if you think about the amount of students we churn out, do they know what's on their doorstep in the ecosystem? I would say probably not. And when I said to you before, as a former student of mine, or I speak to people and say, well, they're actually based over here, 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 and this is what's in the ecosystem, people, I didn't know it was on my doorstep. So we need to challenge that. So I think there's two divides going on. There's a social divide and there's a digital divide. And a lot of them, it's a typical Venn diagram. There's overlap and there's a fuzzy bit in the middle. And I want to challenge and tackle the fuzzy bit. Yes, it's ambitious, but think big or go home has always been my thing. But I've built a nice network around me of different people who have skill sets and influence in different areas. So you mentioned before, I'd just been appointed to the Prime Minister's Challenge Group for Dementia. And you go, why dementia? Well, my mother's got early stage vascular dementia. I've watched her really struggle throughout lockdown. And I think, well, at least she's got me there to support her. But what about, there's over 850,000 sufferers in the UK. What if they haven't got the support system? What if they're reliant on a carer? The carer also comes maybe from a marginalised background, doesn't know how to access, or, if they're dark side, they could scam this person quite easily. So there's lots of work and areas that we need collective work, because I can't do it all by myself. Nobody can. But if we come together and actually break down the barriers between industry, business, health, and government and regulators, then we should get a better thing. I mean, I have to say the regulators are moving forward. We've got sandboxes. So this is where we're all supposed to play together. But the trouble is, when you think about the opposing intentions and rewards for academics versus industry, you need to iron out those issues around process, people and culture, because industry culture, academic culture, very different animals. And I think these are the things I'd like to tackle in working with different people. And I'm told I'm one of the few academics, that will look at the theory meeting the practice and You said before that led to 2 years of being voted in the FinTech Power List produced by Innovate Finance. So that's great to get the recognition, and then to be able to be asked to sit on a group like this to actually live that passion and work with other passionate people, because it's not just me, it's bigger than that. It has to be the team of researchers we've got working around me and that I co-lead with Ard. And then other people in the business school like Rebecca, like Ronnie, and other people who are looking at the digital. And then if we pull together the different aspects, then good stuff happens. That's what I think.
Absolutely. And it's like you said, it's people, teams, cultures, systems. There's so many areas that come into that Venn diagram and the way we work. But without academics like yourself who are championing for normal people, ordinary humans, but also interpreting all of the data, the science and the philosophy around it, it's really very broad reaching. So I am so delighted as always to talk to you, and I'm delighted for you that you're getting recognition with things like the Innovate FinTech Power List, Women in FinTech Power List, 2 years in a row, but also all of the other accolades and achievements you've had. There's just one last question I want to ask you. So I'm asking everyone this because I'm really curious to know, but what is one word you would use to describe Newcastle University Business School?
Developing. That would be my word.
Out of interest, why?
Because I think, again, it's got to adapt. You know, if you look across the pond to the Ivy Leagues, they're working much closer with industry to understand, to get that hybrid knowledge, to build better programs, and to speak to what students want. I think that's why we're developing. And then we should be. You shouldn't sit still.
Perfect. Thank you so much for coming in.
Thanks.
Hello, Fiona. It's wonderful to have you with us today.
Hi, Ash. Lovely to be here.
So first of all, it's great to have you in the studio. You are, like many of your academic peers, someone who wears many hats and you're involved in many networks. So I would love to know a bit about you in your own words. What would you like people to know about you who might be listening?
Well, I'm a kind of born-again Geordie. So I moved up here in 1990 and was always very interested in regional development. I worked for a while at NatWest, really working with their small businesses. Then decided to have a child and realised I didn't want to go back to working at NatWest. So I took a PhD at the Centre for Urban and Regional Development Studies at Newcastle University as well. And that was involved a lot of engaging with lots of different clusters of businesses. And then from there, I took up a post at Newcastle University Business School in 2006.
Wonderful. I love that. And I love hearing a little bit about your journey. And we've actually been talking to some of your peers this week already, especially from the Centre for Rural Development. So it's great to hear, some of the work you've done already. But I also know that you are very, very involved in our creative scene in the northeast of England and working with creative businesses, creative companies. So could you tell us a little bit about those networks that you are working in as well?
Well, so I've been involved with Creative Fuse Northeast really sort of since it started, since the project started. In fact, before the project started, I was just reminiscing with colleagues that the first idea for Creative Fuse Northeast came about in 2014, following on from some work that our now colleague, Jonathan Sapshead, had done when he was at Brighton before he joined us. So that's involved working with lots of different creative businesses in very different ways. So we've run creatathons, which is a sort of version of a hackathon with students and small creative businesses. And then we've also, we ran B2B Create and Innovate, which was a version of Captured, which is the main programme that I run for small businesses.
Creative Fuse Northeast, the 5 Northeast universities collaborating to support the creative economy. Find out more at creativefusene.org.uk.
What is the value or the benefit to small businesses or groups in our local communities of actually interacting with the university? What could they get out of it?
Well, I suppose just sort of specifically looking at our sort of captured programme, I think they get value out of the actual programme. So it involves matching small businesses with managers and leaders from larger regional firms. So that's one particular one that we might want to talk about sort of a little bit later on. But I think it's often difficult for small businesses to engage with universities because there doesn't tend to be a sort of front door. So I think that there's lots of advantages to engaging, sort of access to our fabulous students as interns or with projects in the curriculum. But it can be very difficult to find a way in. So I think having projects like Creative Fuse, Captured, other projects that we're running with the Millen Charity, I think that just gives a way in for small businesses to be able to access the university, to access research expertise, and to see that we're not really scary. We're not really scary and unapproachable.
It's interesting, that idea of being scary and unapproachable. Where do you think it might come from? Is there something that's led to that? Is it a stereotype of universities? Is it is it a fear or intimidation of academics? What do you think it's about?
I think that sometimes the worlds of academia and small business are just too separate. I suppose because of my background working with a lot of small businesses within NatWest, I've always done sort of what in academic terms we would call engaged research, but it just means that I research with the small businesses that feature on the programmes. So I think it's just maybe a fear that we're all two in ivory towers and we can't sort of speak their language. One of my favourite stories one time was when we were running a project with Creative Fuse, and we were actually in a building, and we were running it in person rather than our recent experiences of running online. And I hadn't had a chance to change my shoes, so I was still in my Converse. And one of the people said to me, one of the ladies who'd come on the programme, said, "Oh, I just love you that you're wearing Converse." She said, "I wasn't sure what I should wear because, I didn't know how I should dress for this kind of occasion." And it was like, I'm so glad that, I probably would have sort of thought that I had to change into different shoes, but it's been quite nice. And sometimes, and I think it's meant in the nicest possible way, I know it is, that people say, "Oh, you're not professional," and I'm thinking, should I be offended by that? But I'm not, because I think it's this: we're warm, we're welcoming, and when I say we've got a team behind Captured. So I think that's just our approach that we try and take, is we really value the input that small businesses give to us. So it's never a one-way relationship. I couldn't do my research without them. And I hope I've formed, relationships with many of them.
I love that, because I know you teach as well. And so one of the things that intrigues me is this idea of the creatives versus the suits. So when I went to study an MBA at Newcastle University Business School, it was one of my greatest fears, because I wanted to do the MBA so much. But I had a block in my head, a limiting belief and imposter syndrome around being a very creative person, doing an MBA amongst a group of corporate people. And actually, most of my colleagues were very corporate backgrounds, so it could have been manufacturing and being shoe, the leads on big shoe manufacturing firms, or architects. So there were very creative people there as well. But I really had a block on it. And actually, what I found, and what I found speaking to one of our current MBA students, Janine, earlier, is that actually you can still bring so much to the table as a creative, of a different way of thinking, seeing patterns that others might not, a very unusual perspective that maybe someone else might not have.
Exactly. And I think, obviously, diversity is a real issue in the whole world at the moment. And, I'm passionate about encouraging diversity, but I think it's more than, gender, ethnicity, cultural backgrounds. It's actually different people genuinely have different ways of thinking. So when I teach, we have one of our assignments is that we just say to groups of students, with lovely diverse cohorts, and again, disciplinary backgrounds, gender, nationalities, ethnicities, really lovely diverse cohort. And I think you've spoken to Louisa who studied our programme as well as Dan. So they're very, very diverse cohorts, and we just put them into groups and say, right, you are going to produce a creative output. You are going to present your creative output. And we just say, there are really no rules. Just don't do anything illegal. Don't do any harm to anybody else. And of course, this year we had to say, and abide by all COVID security rules as well. And they just, we don't really give them any other guidance. We tell them that, how they present, teach them how they should present things, but they just blow us away with what they come up with. Even this year, when they were entirely online and working remotely, we were just blown away.
I love that. And I love that a concept of just having the freedom to create something outside of the box. And I really do feel the value of collaboration. The more diverse your group, the better your output will be. So it is something I find often, sometimes you can have friction in groups in workplaces, but actually it's where that friction is that you get the best results, because if you don't have the friction, you can't have the new ideas.
Exactly. And one of the things, you mentioned the sort of creative versus the suits, and we go through that, but also that notion about where is the friction. If it's friction between people, that's not a good idea, but if it's friction between ideas, that's necessary. And that's one of the things that we ask the students to reflect on after they've done that project is, how did it feel working in the creative team? How did you manage those creative tensions? Because if you all agree with everything, you'll just end up with one dominant voice, and everybody else will feel that they don't have that psychological safety to kind of put forward their ideas. So yeah, I love that. I love all parts of my job. Maybe not so much the bureaucracy, but
I'm curious as well, because you work with a lot of creatives, and because one of my personal research interests is around neurodiversity and neurodivergence. I often see that some of the most creative people can often have difficulties with feeling sad or other challenges. And I'm just curious about whether in your work with any of the creatives you work with, do you get to see anybody who maybe, you mentioned about not thinking in the same way. And that's where I'm curious about, through the Captured program or through your collaborative networks, do you get to see people develop and expand their thinking in different ways? And do you ever see that type of witness, even the ways that people take in information, reflect back information in a different way?
Definitely. And I think one of what the strap line, I suppose, for Captured is connect, reflect, develop. So we really think that reflection is really important. But yes, you see people who come on the programme, they might be very, very quiet. And one of the things they tell us or have told us is that they grow in confidence. They grow in confidence as a business person, because as you said, sometimes it's that creative versus suits. I'm creative, but am I a business person? Do I even want to be known as a business person? Sometimes in arts, business is bad, it hampers your creative practice and so on. So I think, you can really see differences in people's confidence. And partly I think it's because they've had somebody from completely outside their business, not a friend or family member, because sometimes, I was talking to somebody yesterday and she said, family either think the business is much bigger than it is or much smaller than it is. She said it was lovely to have somebody from an outside organisation who could just see the business from the outside, sort of just give me some tips and just as a sounding board. Sounding board's often the thing that we constantly in our interviews, that term is used, sounding board, or having a mirror put up to you so that you can see yourself. So that doesn't really go to the neurodiversity point, but I think it's really helps business owners to step away from their business and kind of look at it from the outside. But yeah, in terms of sort of probably, not most, but we worked with somebody with autism, and I found that fascinating because when he was talking about his business, he was really, really articulate and fantastic. And you could obviously see that he was in the business computing sort of, if you've got a problem with your computer, he was your man. But he would then, when we were over lunch and things, he would just go and sit by himself. And we just knew that he would say to us, yeah, I'm going to do that. Don't be offended. And I think that's the kind of environment that we've managed to create, though obviously moving online's been a bit, has challenged some aspects of that.
Absolutely. I think it's a really good point as well, what you said there about, in any situation, making your voice heard and having the time to say, you know what, I need a bit of time to recharge. I need a bit of space just to re-energize and that sort of thing. So really interesting. I did want to ask, so we've spoken about people, we've spoken a bit about networks and collaborating, but I would love to know a little bit more, and I'm sure our listeners would, about your research.
So I suppose most of my research historically has been based on how universities can engage with their organisations within their region for regional development. And Newcastle University and the region are obviously a really good place to sort of practice that. So historically, I was looking at how the university could engage with the subsea sector to sort of develop their future workforce and so on. So that goes back quite a while, but I still keep the relationships from there. And again, all my researchers tend to be very engaged research. It's always had an output for the organisations as well as sort of in publications. So that's been one strand. And then the main research that I have now is based around the Captured programme. So we've more than 130 businesses have now gone, small businesses have gone through the programme. We've recruited managers from more than 30 organisations. And so we are researching the programme. We're very open about it. We're researching the programme as we go. We conduct interviews and focus groups with the people who participate on both sides. And we've just found that there's something particular about this way of doing things. So just to give you a bit of a history about the project, in 2015, UK Commission for Employment and Skills, who no longer exist, had a call. They said, we want to find anchor institutions. So anchor institutions, large, regionally rooted businesses, or not necessarily businesses, actually, should say, usually universities, chambers of commerce, hospitals, particularly in the States. How can anchor institutions support local businesses? And I'd worked ages ago with Stephen Green, who was then at the Entrepreneurs Forum. He's now set up a new company and has been doing some work with Innovation Super Network. But he had we'd worked on an initial sort of idea that actually, wouldn't it be good if you could bring big businesses together with small businesses? Now, in academic literature, no, that wouldn't work because small businesses can only learn from other small businesses. It's quite a controversial sort of proposition that we were trying to. So we pitched this to the UK Commission for Employment and Skills. We won one of 8 projects, and that was the birth of Captured. So as I said, we've been researching it for 5 years, more than that, since what we were finding, because we always set out that it would be a research project, what we found was that It worked particularly well because of the setting. It seemed to be that the presence of the university was sort of attractive to both the large businesses and the small businesses. We very much felt that the atmosphere in the room was important. The processes we found were significant, so that people felt that they learnt from the. It tends to be cohorts of 6 to 8 small businesses going through a series of workshops. So they learnt from the small businesses. They liked connecting with the small businesses. Then that role of the managers who come in and work one-to-one with the businesses, that was also very beneficial. This thing about the sounding board and giving them a chance to step back and reflect. So that was important. And the other thing was that it was really important that the outcomes were very much tailored to their needs. So it wasn't like going on a standard course where, with the best will in the world, you're sort of one of many in the standard kind of materials that you have to take in or use. It was enabling that business to focus entirely on their personal needs. So that was really why it worked. So of course then we come to can we take this online now? So this is the sort of the fresh research that inevitably we've been having to do. So I can remember back in about February 2020, we were running cohorts of Captured, and we were out in North Shields doing all the extra hand washing and stuff and feeling a bit nervous, and then obviously with lockdown that sort of ceased. And we took a while to decide, we didn't feel it was appropriate to go immediately online because people were just coping with whatever, keeping their businesses going. But this year, so from the start of 2021, we've been able to move online, and all our nervousness about would this work online, we think that it has done. And while all our concerns would have been about how do you get that atmosphere, how do you get that welcoming, friendly atmosphere, it seems to have, fingers crossed, touch wood, seems to have worked. And some people have specifically said, actually, you mentioned imposter syndrome, beforehand. One person said to us, do you know what? I might not have even come if I had to come to a building because I don't like that networking bit. Other people have said, yeah, it's still conversations. We've got used to being in breakout rooms and things. Other people said it's much easier because, my husband can come back from night shift and I can be here. There's no travel, don't have all the parking issues. So it's actually, we feel that the processes, that conversation, the sounding boards are, fingers crossed, still working in a digital version. And one thing we've really found, it's much easier to stop people from talking too much in breakout room when you're in. So normally Lee Sear, who facilitates these workshops with me, he and I always used to say our main roles was to break up people's conversations. It's much easier to break up a conversation when you're in a breakout room and you can just press that button to say, 2 minutes and you're back in the main room.
Well, on the note of breaking up conversations, we should probably wrap this up because I know that I've still got 2 more things I wanted to ask you. So the one question I want to know, and I'm sure lots of people listening will as well, of course we can share your links in our social media, and in our show notes we can put any links to any networks, but I'd just like to know, for anyone listening who wants to get involved in your Captured program, whether it's online or face-to-face, is there anything you'd want to tell them or about how they can get involved?
So they can look up Captured at Newcastle, on the Newcastle University website, and we'd just love them to. There's an application form. It's not an onerous application form at all. We'd love them to fill that in. Jo, who works with me, who's wonderful as well, she and I are always interested in seeing new applications from small businesses, but also we're always keen to get larger organisations to be involved as well, because not only have we found the small businesses get so much out of it, and we get so much out of it from a research perspective and just from a warm and, it's just one of the best bits of my job, but also the managers from the large organisations really appreciate getting involved. So anybody, small business, big business, get in touch with us.
Perfect. And the last question, which I'm asking everyone because I love asking these types of things, but if you could describe or think of one word that you would use to describe Newcastle University Business School and what it means to you, which one word would that be and why?
Collaboration. Because I think there is so much opportunity to bring together people who would not normally meet. So convening power, you see, I'm taking liberties, I'm now using a different word, but that notion that we have so much opportunity to bring people together, to collaborate, would be, I love that bit.
Perfect. Well, I love that bit too. And I think it's a great way to collaborate, even like today, to have the opportunity to chat to you, hear about your research, and hopefully touch some new listeners who might want to collaborate with you as well. So thank you so much for coming in today.
Thank you, Ash, for taking the time to talk to me.
Thanks for listening. We'd love to hear your feedback. You can drop us a line at nubspodcast@newcastle.ac.uk. And you can also tag us in any of our Newcastle University Business School social media channels. You can find these links in our show notes. Don't forget to like, subscribe, comment, and share with your friends. This podcast has been brought to you by Newcastle University Business School. Your host has been Ashleigh King, with executive production by Ashleigh King. Photography by Paul Scurra of That Branding Company and Blind Sea Photo. Production by Alice Smith and Tim Lazinski at TL Multimedia Limited.